Thank you guys for joining us. I'm Paula White, Four Oaks Medicare Planning, and here with my husband / business partner, Jamin White. He's going to be giving us an update for advisors. It's financial advisors and benefits advisors. So hopefully you'll take away some key information from what's happening in the Medicare world, which is actually a lot. So a little bit about Jamin. He's our speaker today. He is a co-founder for Medicare Planning. He does have his JD from the University of Texas Law School, and is an ex-lawyer, as we call it. Not a former lawyer, he's an ex. Left that with a vengeance. Anyway, he is not only licensed and independent, but also AHIP certified, which means that he's, able to sell all the major plans from all the major carriers. So very diverse and comprehensive in the offerings and his knowledge base. And then, he also has experience with corporate benefits and HR, and so has been kind of on both sides of the fence on that. So with that, I will pass it over to Jamin to give us an update here on what's kind of happening and talk more about the shakeup.
Well, thank you so much, Paula. I appreciate that. So yes, I'm excited to be able to come before you and just kind of give you some updates on what's going on with Medicare. Just a little bit about how this presentation is going to work is we're going to always talk a little bit about the basics of Medicare so that, everything that so you have some context. And then also just a little bit of a refresher so that you know what your clients are dealing with as they're approaching 65 and what that looks like, some of the pitfalls that you need to be on the lookout for. And that way it'll just help you to be better informed so that you can advise them a little bit. But obviously there's a lot of details that go beyond with Medicare. So that's why we're here. So we're going to talk about the basics, and then we're going to dive in a little bit deeper into the upcoming 2025 changes in the law and the rules. There's going to be some specific things that are going to be happening. There's a lot of things converging in the Medicare market right now that are going to affect pretty much everybody as we go into the new year. We'll be getting a little bit more information as the summer unfolds, and then during the annual election period in the fall is where your clients really need to be paying attention on what is going on with their Medicare so that they're not surprised when the first of the year rolls around. So part of what our job is with Four Oaks Medicare Planning is really, this is what we do. We're full service Medicare because so many of your clients, so many of our clients, when they're facing Medicare, it looks like a huge maze. It's very overwhelming, not sure what steps to take and if they're taking the right steps. So, our firm is here to help you be a resource for you, not only your clients, but also you, so that you feel like you have somebody to turn. So this is not so much of a maze and it's not so confusing. So let's just go right into the basics a little bit, just as hopefully a refresher for most. If this is your first time entering the Medicare world, well, welcome. And hopefully by the end of it, you'll feel like this has been an informative presentation. So the building block that we build on with Medicare is it's called Original Medicare. It's what's offered directly by the government, and it's divided into two parts, Part A and Part B. So you'll notice A is called hospital and B is called medical. So just think hospitals like inpatient, you spend the night in the hospital, generally that's going to activate A. And then when it comes to B, that's the medical. Think outpatient, doctor visits, MRIs, even like chemotherapy on an outpatient basis, that's going to trigger B. So the thing that's really important to remember on A and B is it is really just the starting point when someone is trying to build out and make sure that they have the right coverages for Medicare, because there's many things that Medicare doesn't cover at all. And what I mean by Medicare is Original Medicare. So it's not going to cover all costs. There's no out-of-pocket maximum on Original Medicare, and we'll dive into that a little bit deeper, but just remember that's a biggie. Prescription medications, that's Part D of Medicare as in David. So A and B do not do medications that you pick up at the pharmacy. So we have to look at a drug plan. Dental, routine vision, hearing aids, eyeglasses, those are not covered under original Medicare. Long-term care, custodial care, sometimes people get confused. That is not a function of Medicare on a long-term basis. Excess charges we'll talk about, but also care outside the United States. If you travel a lot and you're outside of the US, obviously this is a federal program, so you know it needs to be aware that the care is more limited throughout foreign travel. So let's just kind of talk about how A and B work. So in 2024, this year, A doesn't cost anything for most people. It's called a $0 premium. That's usually because your client has worked at least 40 quarters over their life, paid into the system, so they get premium-free Part A. But when you go access care under Part A, that's not free. So for example, there's a deductible. It's $1,632 this year. The government does adjust these each year. So this is for 2024. Now you'll notice it says per benefit period. It's just really important to know that most people, when they think of a deductible, it's like an annual deductible. That's not how Medicare Part A works. It's actually per benefit period. It's a 60-day window. So if someone's discharged and goes back into the hospital outside the next 60 days, then they're going to hit that deductible again under Part A. And then obviously, if you're in a long-term situation in the hospital past 60 days, then you're going to start to pay some per day costs, and those can get pretty expensive. And then again, there's no out-of-pocket limit, and we'll touch on that again on this next slide. But let's talk about Part B. Remember, this is the outpatient component of Medicare, and there is a premium for this. The government sets this each year, and so for 2024, that premium is $174.70 a month. Now, it is for most people, and we'll get to this in the next slide. It can be higher if you have a client that has a higher income. So just remember that, and we'll talk about what that looks like. But just for the sake of argument, once you go on to Part B, then what are the out-of-pocket costs? So for example, there is an annual deductible under B. It's $240. And then it's basically 80% the government pays for most things, and 20% the Medicare beneficiary is going to pay. And then you'll note on the right side, it says no out-of-pocket limit. So let's talk about that, because this is really important. I call this the ugliest part of original Medicare. And so if you remember kind of on traditional insurance, there's usually an out-of-pocket maximum. And what that means is once you pay your deductible and satisfy a certain amount of copays, if you ever hit that amount of money out of your pocket for the year, the policy converts and starts paying 100% for the remainder of that coverage year. Medicare A and B do not do that. So if you can see the 20%, your 20% could be 20% of 5,000, or it could be 20% of 500,000. There's nothing that ever caps that. And so again, that's why I mentioned at the beginning, original Medicare really is a starting point, because that's a risk that we definitely want to mitigate. And we'll talk about that in a minute. But let's talk about if you have a senior that has a higher income. This is called the IRMA. It's an income adjustment. So remember, the base price for this year is $174.70 a month. But if you're hit higher brackets, then you are going, then that can be surcharged at a higher rate. So you're going to notice a couple of things. At the very top, you're going to see where it says 2024 Medicare premium. So what that person would pay this year. But then notice when you look at the left-hand side, there's two columns, and they say 2022. So that's something you have to be aware of, that they look 2 years back on the income surcharge. So in 2024, they're actually pulling the modified adjusted gross income for that person or that household for that 2-year look back. And that's what's going to set what the Part B rate will be. And you'll notice there's 2 columns, the Part B rate, and then Part D, we'll get into this, but remember that's a drug plan option that can also be surcharged by the government if the senior is still in that higher income bracket. So anyway, the main thing is just to remember that you can pay more depending upon your income. So let's talk about some common pitfalls and some reminders, because this is some of the most common questions that I get on an everyday basis when I'm talking to a senior, specifically that is trying to figure out what to do as they're approaching 65. They're getting inundated with tons of mail. That's where they feel like they're in a maze and they just want to get some straightforward answers so that they can make some good decisions on what to do. So let's talk about that and kind of separate the facts and myths. So one of the main questions as someone's approaching 65 is, I've been told I need to sign up for Medicare. I don't want to be penalized. I keep hearing that I'm going to be penalized a lot. So that is true, that you can be penalized if you do not go on to Part B when you're first eligible, but there is a caveat, unless you have qualified other coverage. So many people work past 65 nowadays, and so most of those plans are going to be considered qualified other coverage. And so that's going to allow someone not to have to endure a penalty if they want to continue working and stay off of Medicare for a time. So let's talk about the most common instance of when someone has other qualified coverage, and that's going to be employer-based health insurance. But this, again, is a little bit of a pitfall that you need to remember, or just have a little bit of a trigger of, hey, we need to talk about this a little bit more, is if someone wants to continue to work past 65, it really matters how large their employer is on what they do with Medicare. So for example, if you work with a large group employer, and that is going to be under these rules, 20 or more employees, then that is considered a large group employer plan. And you can keep that plan because that plan is designed to be primary under the rules, and Medicare is secondary. So even if that person wanted to go on to Medicare, it's going to be secondary to the employer plan. Well, a lot of times people don't want to pay the extra premium for Part B. Maybe they have an income surcharge, or maybe they're already paying enough and they like their employer plan. That would be an instance where someone could delay Medicare until they were coming off of that employer plan, and maybe terminating or going in, or retiring, and then go ahead and add Medicare at that point. Now, what is the situation if it's less than 20 employees? Well, it actually reverses, and that's something that's very important. If you're with a small group employer, which is less than 20 employees, Medicare is designed to be primary to that plan. And so Medicare recommends that that person actually go ahead and go on to Medicare Part A and Part B, just to make sure that there's not going to be any gap in coverage, because those are legal contractual concepts, primary versus secondary. So you don't want to be in a situation where your plan is secondary and that group plan points and says, well, we're not covering things as primary because you should be on Medicare. So just be aware that the size of the employer is going to determine what options you have on whether to delay Medicare or whether to go ahead and get it added. Now, another little pitfall that's important to remember is someone who is contributing to a health savings account. So remember, a health savings account is someone that has maybe a high deductible health plan, and they're putting aside money every month that grows and has some tax benefits, but also they can utilize for health expenses. Well, in order to get those tax benefits, you have to be under a high deductible health plan that qualifies. Now, if you go on to Medicare, that will suddenly cause you not to be able to go on to continue to contribute to that health savings account. So just be aware of that, because sometimes someone who is working for a large group employer, they might add Part A and decline Part B, because if you remember, Part A is secondary and it doesn't cost anything. So in that instance, there's a lot of people that would go ahead and elect A and decline B because they have a large group employer plan. But if they are contributing to an HSA, they do not want to go on to Part A either, because then that will disallow any additional contributions to that HSA account. And the other thing to remember too, from just a timing perspective, is I'm not sure why the government does this, but remember that Part A is actually retroactive when it goes into effect, back 6 months or back to the birthday month, whichever is shorter. So just someone delays Medicare for 2 years, they're going to want to stop those HSA contributions for 6 months prior to when they're going to enact A, so that that window is not going to cause a problem with the with HSA contributions that are now no longer allowed because the Part A went retroactive. So anyway, enough about that. Just note also 2 other things. Veterans benefits is not creditable Part B, so they would be subject to that late fee of the 10% per 12 months of not being on it unless you have the qualified other coverage. Veterans benefits not qualified other coverage for Part B. The same thing is true with COBRA. So just remember, for the sake of Medicare, COBRA is not the same as active employee insurance. So the rules we just talked about do not apply to being able to delay Part B without a penalty. COBRA is a little bit of a sticky situation, and you don't want your client caught in that. So let's just visit a little bit about when someone would enroll. Remember that this plan is generally for those that are turning 65. Obviously, there's some other instances. If you're on Social Security disability after a 24-month period, you don't have to be 65 and you can qualify. But for the most part, most people that are turning 65, this is their enrollment window. It's a 7-month window, 3 months before your birthday month, and then 3 months after. Just note that if someone's drawing Social Security already, they're going to be automatically enrolled in A and B. Otherwise, you have to go and do the enrollment with Social Security. Though you don't have to take the benefit, Social Security does handle Medicare enrollments. So when it comes to someone who is working past 65 and wants to delay going on to Medicare, that's a situation where it's okay, because there's going to be a special enrollment period that opens up. And what that's going to do is allow someone to go on to Medicare outside of that 7-month initial enrollment window. And so just be aware that for losing employer coverage is typically, this is what that enrollment opens up with. You have an 8-month window. You have a little bit of a different window for some other parts of Medicare, but just be aware that usually you don't want to wait until during the 8 months, once the person's already lost their employer coverage. We usually want to handle it, 2 to 3 months before that time, so there's a seamless transition. So just be aware that there is a special enrollment window that opens up to go on, and it's a little bit of a more in-depth process, so just be aware of that. And so a lot of times I tell people, contact me 2 to 3 months before that separation is going to happen from your active employee insurance, so that we can make sure and handle that. I'm going to save any little questions at the end, but feel free to use the chat function, and I will happily take questions. So when it comes to how to deal with those issues, remember the no out-of-pocket maximum, the no prescription medications on A and B. What do people do? And so really there's 2 main options, though there's lots of companies that have their options. There's two options that people will choose from that really accomplish the goal. The first one is enrolling in what's called a Medigap plan. Medigap plans are really popular, and they're designed to give you almost 100% coverage. The other option is going to be a Medicare Advantage plan or a Part C plan. Those are an all-in-one bundled option that people can choose from that have out-of-pocket maxes in them. So they're more geared, again, like these are more tailored like an employer plan that the senior might have had over their lifetime. But these are the two options that deal with it. So let's talk about the Medigap option really quickly. The Medigap option, I will tell you, is very popular because it offers a level of coverage that you probably have never experienced before. A Medigap plan essentially goes in, and anything that you have to pay for under A and B, like that 20% or that higher deductible under A, the Medigap plan is going to pay all of it or most of it, depending upon which plan that the person would pick. But it's a way that you can get almost 100% coverage for hospital and medical. That's what it makes it very unique. This chart is just the standardized chart that the government that the government has that people can choose from these lettered plans. I know there are more letters, but this is how it is. But let's just look at the chart real quick so that you can kind of see. On the left-hand side, you'll see under benefits, that's just what the person would have to pay for if they didn't take anything, they just had A and B. So you'll notice, the second row down, Medicare Part B coinsurance. Remember, that's the 20%, or there's the Part A deductible. So if you look over on on the right-hand side, you see all of these percentages down each column. That's just how much of the gap the Medigap plan will pay for the person. So if you look at like the G plan, just scroll your eyes down, it's almost 100% on each category. So that's what I'm saying is generally you can have almost 100% coverage. So it's quite comprehensive. Now, it's really important for someone to know that a Medicare supplement does not have any health questions. You can, when you're turning 65 or going on to Part B for the first time, that you have a pick of any of the Medigap options. Health status does not matter. There's no underwriting. Later on, that changes. So it's always good to really the client to understand their options, because later on, this might not be an option that they would qualify for. Now, some of the things that we're going to be diving into is what's going on in the market today. I know for some of you guys, this is review, but I wanted to set a context, because one thing that's important to understand on the Medigap and as being, advisors and, dealing, as part of benefits groups and things like that is costs matter. We're seeing a lot of Medicare supplement rates increasing. So if there's someone that is already on Medicare and has a Medigap plan, they're going to feel the rate increases that have started just due to inflation and higher utilization. This is a quick little chart that kind of just tells you what's been going on. You see a really huge dip. This is Medigap plan loss ratios, and this is just going to really tell you that utilization is increasing. These Medigap plans are having to spend more and more money as people go out and utilize the system more. And you'll see a definite change between pre-COVID, then during COVID, made a lot of money, these Medigap plans, and then now everyone's going back in and utilizing the system. This is what we're seeing right now, and what follows this type of increase are rate increases. So something that's just really important for people to understand is these insurance companies are going in on Medigap plans and really putting in higher rate increases than we've seen over a while, actually. And you'll notice that this chart is actually showing the reason why we haven't had loss ratios as high from before 2006 on this chart. And so that is going to unfortunately reflect itself in people that have Medigap plans having to deal with rate increases so that they can try to maintain their profits. And we'll get into that again, a little bit of that. I wanted to remind you a little bit of the Part D plan. So remember, under prescriptions, there's two ways that you get prescription coverage under Medicare. The first one is a standalone Part D drug plan. That's one way. And then the other way is through a Medicare Advantage plan, where it's actually bundled in to the Medicare Advantage plan that's offered. And so one of the things that is important for people to understand a little bit is Medicare prescription drug coverage. The way the system is programmed is very, very confusing because you go through different stages of coverage. So that just makes it hard because you can pay a certain amount for your prescription 1 month, and then several months later, you've moved into a different phase, and then suddenly you're paying a different amount. So the really most important thing on drug plans is which one is right for somebody depends upon the specific medications that are being taken, but it's always a good idea to do a review because of the changes that not only happen each year, but some of the new legislation that's phasing in will definitely, we'll be addressing that as well. So one thing I just wanted to go back is just to make sure these are the two options that most everyone is going to be on, either the Medigap option with a drug plan or getting a Medicare Advantage plan. I want to just mention, remember, a Medicare Advantage plan is different than the Medigap because in a Medicare Advantage plan is more like the type of employer insurance or commercial insurance that someone has experienced in the past, where this plan is developed where you bundle in and get your A and your B. Like I mentioned, the drug plan would be part of it. And then also like there's other benefits that these plans can offer, like dental and vision. So, but these plans have out-of-pocket maxes as part of them as well. And so it's definitely the two different choices are what most people are going to be on. Over half the country's on a Part C Advantage plan, but obviously also the Medigap plans help also serve the purpose of insulating people from the really high costs that can happen under Medicare Part A and Part B. So that kind of finishes up our basics. And now I want to get into some of the more the more current information of, well, what is happening to Medicare? You know, you might have seen a lot of stories, news stories and things where Medicare, a lot of changes are happening. And so I want to really focus and dial into some areas because they're definitely going to translate into seniors seeing a difference with Medicare as we go into 2025. So the first thing I want to visit about is the Inflation Reduction Act. This was a piece of legislation that passed back in 2022, and there's a phase-in of certain things that are happening where they're phasing in part of the laws on a staggered basis. It started in 2023 on a more limited basis with kind of income, insulin cap, copay caps. In 2024, it was really beneficial to some people that took very expensive medications because they eliminated the 5% coinsurance of the last phase in the Medicare Part D plan. Used to, people would pay 5% at the end of at the fourth phase, but now it is gone to zero. But what's happening in 2025 is really, really important because they're actually implementing an out-of-pocket maximum for all Part D drug plans. Now, what that means is for the senior, if they're taking very expensive medications, their out-of-pocket max for their drug costs for the year is now going to be capped at $2,000 for the year. So someone that takes very expensive medications this is going to be very, very important. and allow them to likely save quite a bit of money. So we'll talk about some of the impacts that that's going to have. The other thing you'll notice is in 2026 and beyond, there's some negotiations that are happening on certain medications each year, where Medicare is going to have the ability for the first time to negotiate certain drug prices directly. And so the idea is, again, to use their negotiating ability to bring down the overall cost of some of the more expensive medications that are commonly seen on the market. But let's talk about what's going on with drug plan premiums, because this is, again, one of the aspects. It is great for all of these the new legislation to go into effect. And really, it sounds great to have an out-of-pocket max of $2,000. It's definitely going to help a lot of people. But part of it is who's going to pay for it. And that's where you don't hear the politicians talk too much about this. And this is what I want to mention a little bit. Remember that I told you in 2024, they removed the catastrophic 5% coverage. And then in 2025, they're going to put in the out-of-pocket maximum of $2,000. One of the things that I wanted to show you was what happened in 2024. A lot of this, I think, was because of what happened with the catastrophic phase being eliminated. Just notice that drug plan premiums increased of more than 25%, a 25% increase from which plans premiums were they compared between 2 years and then the next 2 years. You'll notice in 2024, there was a dramatic increase in a lot of drug plan premiums. And so we're starting to see the impacts of the Inflation Reduction Act. And obviously, this is impacting seniors' pocketbooks. But here's what I want you to see as well, that this is a chart that's showing the share of the Medicare drug costs paid by the enrollee, the plans, the manufacturers, and Medicare. So obviously, it's who's going to be paying for what. I want you just to really look at really quickly what happens where you see the catastrophic coverage in 2024. Do you see where it says 80%? And there's that green box. Medicare was paying for most of that. If you look down at 2025, now that they are implementing the out-of-pocket max of $2,000, you'll notice that the share that Medicare is paying is gone from 80% to 20%. If you see the dark blue box, if you look up, that's the actual Part D insurance company. Their share of costs are going from 20% in 2024 to 60% in 2025. That is a huge amount of money potentially that now the insurance company is going to have to bear. And so what do you think might happen because of that? They're going to try to find ways to offload that burden. And one of the ways that they can do that are premium increases. So that's one thing I just want to share is we don't have what those plans are going to look like yet. Starting in October, or actually starting in September, plan changes will be released to the seniors that are already on Medicare Part D plans. But that's what we need to look out for. What is going to happen to premiums? What is going to happen to coverage when the insurance company is now having to pay 3 times more responsibility of what they had the previous year? And in the previous year, which is this year, we saw 45% of plans increased by 25%. So just be aware of that. Hopefully this makes a little bit of sense. Insurance companies are not going to be charities, and they're going to find a way to make their profit and still be able to offer the coverage that's mandated. One of the things I wanted to mention to you is that this might drive a lot of people that are on standalone Part D drug plans. This might drive a lot of people more towards Advantage plans. This is just a chart that shows they're already projecting over half the company are already on Medicare Advantage plans. They're already projecting that that could be up to 60% in just about just a few years from now, about 4 years from now. So, but again, these are going to be people making cost benefit decisions on what they're going to be able to afford if we see some higher increases in the Part D plans. Remember, the Part D plans are also a part of the Medicare Advantage. So there's no way to get out of the potential effects that this new regime that's going into effect or this new law that's being phased in is going to deal with this. They're going to have to find money through cutting benefits potentially under Advantage plans or raising premiums under like the standalone Part D drug plans. Just something also to remember that the negotiations that are taking place on some of the more expensive medications, these are ongoing right now, but we're not going to see when these negotiated prices take into effect until 2026. So it's a little ways off. And these are just some of the medications that are on the docket for the 2026, the negotiations for 2026. So you might just see some of those blood thinners, Eliquis, those are the big ones. But you'll see some of the non-insulin diabetes medications too. But anyway, if anyone, this is just information just for you to be aware of that of what's going on as part of this new Inflation Reduction Act. So what are some of the takeaways with the Inflation Reduction Act in Part D? Seniors with high dollar medications will benefit from the $2,000 out-of-pocket max being implemented. But as you see, upward pressure on Part D premiums will continue as the insurance company's liabilities increase within the Part D market. As we saw, more seniors may move into Advantage plans to offset the rise in Part D premiums, meaning they might decide they're going to drop their Medicare supplements potentially, just trying to save money, depending upon their financial situation. And then Medicare Advantage plan premium and benefits are also going to be negatively impacted because remember, the Part D plans are bundled within there. So it could be some benefit reductions or maybe some premium increases on Advantage plans so that's what we're awaiting, but we're just seeing some of the writing on the wall. And so early signs that we're seeing, people are making decisions, but just Cigna's divesting all of their Medicare business and selling it to basically HCSC, which includes Blue Cross Blue Shield. Consolidation will occur. One carrier said only the strong will survive these changes. Another carrier rep said if these changes go through, every senior is going to want a review of their current plans, just because there's going to be potentially a lot of changes. And we're already heard of one carrier already planning to leave the Part D market, specifically citing the Inflation Reduction Act implementation of what's happening right now for the out-of-pocket max going in. So that is really just a sign of one thing that's going on that is going to be affecting premiums and coverages. But there's also another thing that's going to be impacting coverages is also just CMS released a rule called version 28. And it's basically, it involves how the insurance company, they have a contract with Medicare under Advantage plans. And so usually under the Advantage plans, the government gives the insurance company a certain amount of money as they're taking on a client to offer their Medicare under Part C. And so they've implemented a new risk adjustment model, but all of this is to say, if you'll read the second sentence in the little paragraph, this translates to a loss of payers of an average of $150 per member per year. So again, there's other pressures on these companies, not only from the Inflation Reduction Act side, but also from these new funding models that are being put in. It was going to negatively affect the insurance companies so much that last year they said that the new risk adjustment model will actually be phased in over 3 years. So it's interesting. There's another side of downward pressure on these insurance companies that offer Medicare Advantage plans. They've really been riding a wave for a while. Benefits have been increasing a lot. Based on all of this, again, we're expecting quite a few changes to hit the market for 2025. And this is just one very recent article from late April. You Google any of these Medicare Advantage and any companies, Humana's one that warns a tough times ahead for Medicare Advantage. They still remain bullish, but they're not adverse to losing clients. They're looking more at profits and just trying to deal with higher utilization that's been happening. People aren't riding the Medicare Advantage wave. These companies and shareholders aren't seeing the level of profits that they had when COVID was here and people weren't going to the hospital. Reimbursement funding was higher. So there's a lot of pressure on here as well. And so this is just something that as the funding is changing and utilization is increasing. One article said a critical question for this year is whether the market has reached a tipping point in benefit generosity. So that's benefits focused on growth and will shift to an environment in which payers are more intentional about return on investment through member retention and improved health. Really what that is a sign of is it better for us to cut back on benefits some and just focus on what we have? If we lose some people, that's okay, rather than just upping benefits as is honestly has been happening over the last several years. So again, there's a lot of pressures coming in a lot of different directions that is quite unique in the Medicare market right now. And 2025 is just going to be a very, very interesting year. So again, 2025 Medicare changes are coming. So someone that is already on Medicare, it's very important to know that the annual election period between October 15th and December 7th is when someone will be allowed to make changes to either their Medicare Part D drug plan or their Medicare Advantage plan. So seniors with these plans should be ready for significant plan changes in 2025 in benefits and premiums. And just be aware that an annual notice of change for their plans will be mailed to them or emailed to them in September. I'm sorry, there's a little bit of in September of 2024. And those should be looked at because there's definitely that's where the first sign of what is going to happen to the plan benefits on either of these things will be shown. Okay, that was a lot of information. We dove into a lot more, but as advisors, and I just wanted you guys to have a little bit of a peek behind the curtain so that you can kind of see what's coming. And you might have a lot of questions from clients or people wondering about what's going on with Medicare. So one of the things we just always like to tell you guys is, again, we're a resource for you all. If you have any questions, we have a survival guide that we put together every single year. You can email the office or let me know. Go to our website and you'll be able to download that as well. So just always know that that's available. And then finally, just know that we try to be available if you have a specific situation that you are interested in or need more information about, or you just have some questions. Don't hesitate. You can call or email. We also have on our on our website a Calendly link that you have access to. If you want to get on my calendar and have some questions, don't hesitate to utilize that. It's all free and just available to you guys. Remember, for any clients, all of our services are always free. No one ever pays us anything. We do get funded through the insurance company, but they're pretty all much standardized. So we try to be a good advocate for the client because we're very relational and want a long-term relationship. And so, but we're always happy to answer any questions that you might have that pop up.